My name's Adrian Richards. I'm a plastic surgeon and the surgical director of Aurora Clinics, which is based here in the south of England. In the previous video I talked about the cause of excess skin and prominence in the arm area and a little bit about the various techniques that can be used to treat this, which include liposuction and excisional techniques of brachioplasty. And brachioplasty is really just the medical word for remodelling of the skin and tissue in your arm area. So first of all, I'd like to talk in this video about liposuction. Liposuction is very good for removing excess, what we call subcutaneous fat, which all that means is subcutaneous means fat under the skin, and the fatty tissue lies between the skin and the muscle. So that's the layer we always perform liposuction on. So the best people for liposuction are relatively young, because when you're younger your skin's more elastic and is more likely to contract. Unfortunately, as we get older our skin loses the elasticity a little bit, so if you do remove the fat, the skin may not sort of contract and ping back as it would when we were young. And the other point is, normally the darker your skin, the more elastic fibres in your skin and the more likely it is to retract nicely. So anyone with sort of Mediterranean type skin, you know, that is thicker, darker skin tends to be thicker and probably more suitable for liposuction because thicker skin also contracts better. So liposuction has the great advantage of involving minimal incisions, so it's relatively quick recovery, very small incisions, normally 2 or 3, which can be, you know, hidden in natural areas, perhaps where you've got a mole, or it could even be, you know, in the armpit area where it will be hidden, and then the fatty tissue is removed by one of the liposuction techniques, which can include vasoliposuction, smart liposuction, or tumescent liposuction. If you are interested in these, perhaps it might be worthwhile having a look at some of the videos on those particular types of liposuction. People that are suitable for liposuction are people really without the skin excess, okay, but have the bulk, have the sort of, if you squeeze this area and there is a significant bulk, if that's more than sort of 3 centimetres, so squeeze generally in your inner arm area, if that distance is more than 3 centimetres, you may well be a candidate for liposuction. The problem with liposuction is that it doesn't really deal with the excess skin. So if you are someone who's lost a lot of weight, has got excess skin in the area, without too much fatty tissue, liposuction wouldn't be suitable for you, because all liposuction is going to do is deal with the fatty element. It does tighten the skin a little bit, particularly in younger people, people with darker skin, as I've mentioned, but it won't tighten the skin totally, and you know, you may well need a skin excising technique, which I'm going to talk about in the next video. It's important, however, to recognise that, you know, liposuction is a possibility. Brachioplasty techniques are possible as well, but they can be combined. So often when I do an arm reduction, I will perform liposuction first to remove the fatty element and then remove the skin element, and I think that gives the best results overall. And to see me performing that procedure, have a look at our operative video section and you'll see me talking about that. So just to clarify, liposuction advantages are simple, quick recovery, minimal scarring. Disadvantages, not suitable for everyone, only really suitable for people with that excess fatty tissue in the area, and not suitable for people with excess skin in that region. Thanks very much for watching.